So I grew up in Spring, Texas, just outside of Houston, and went to medical school there in Houston at Baylor College of Medicine. Yeah, I think for me, it was a long journey of figuring out what I wanted to do. I had a lot of varied interests. And for me, it was realizing that I wanted to be working with people and with families. I wanted to feel like I could make an impact for the good in people's lives and kind of make those personal connections. Musculoskeletal medicine has always been appealing because there's such a clear relationship between structure and function that you can use the physical exam there at the bedside with a patient to figure out what's going on, what's contributing to whatever symptoms they're experiencing. You can show and demonstrate and teach the patient, their family, and help them to know how to recover from that, to rehabilitate, to prevent having these kinds of injuries or issues again. All kind of from that structure and function, mechanical relationship, and I just find that really rewarding. When I first meet a patient, I really like to get to know them. I want to know what their interests are, what their goals are. Obviously, it's important to dive into what brings them in to see a doctor in the first place, and so I do want to know that. But really with that lens of how can we get them back doing what it is they want to do, what they enjoy. So I really want to know what that is, what their goals are, what their hopes are, what's getting in the way of achieving those goals right now, and then figuring out together with them how we can remove some of those barriers so that they can get back to what they want to do. Yeah, one of the things that I really loved about Avera is that they actually practice their mission with the emphasis on having a positive impact on people and communities. Really love to spend time outside in nature. And playing every sport that I can. Really enjoy watching sports and following sports as well, and spending time with family.